It's sun season in South Carolina. Pools are open, the water at the beach is warming up. There are great festivals happening every weekend all across the state. It's a great time to be outdoors to hike or kayak. All great activities as long as you're protecting yourself from the sun. Hi, I'm Andrea Abbott, a surgical oncologist at MUSC Hollings Cancer Center. One of the areas that I focus on is melanoma and other types of skin cancer. And I have with me today Dr. Jane Scribner, who is a dermatologist here at MUSC. Thank you for being here today, Dr. Scribner.
Thank you. I'm honored by the invitation. It's nice to get to sit down and chat with you because I know that we have a passion and an interest in promoting sun safety because we take care of patients with melanoma, but at different stages in their journey.
I'd like to start talking about why we're here today and why we are so invested in sun safety. Something that people may not realize is that skin cancer is the most common cancer in the United States, and over 6 million people each year will be diagnosed. And that is just so many people that are at risk, right? And we want to talk about squamous cell, basal cell, and melanoma. I know a lot of focus is on melanoma being the aggressive cancer, but there are other types as well. So if you look at like the top 10 cancers, you may not see melanoma, skin cancer listed at the top. And that's because cancer registries usually don't carry that information because basal cell and squamous cell tend to be more easily treated, right?
Mm-hmm. Absolutely.
Like, tell me a little bit about the treatment for basal cell and squamous cell, because those are probably more common, right?
No, they are unfortunately more common than we wish that they were. Basal cells and squamous cells can be treated with very, very small minor surgical procedures, even sometimes with topical therapy. So I wish that the numbers were smaller. I wanted to mention the incidence of how frequently I diagnose the skin cancers in clinic. So in terms of the incidence of basal cells and squamous cells and melanoma, I did want to talk about that. In my practice, I am diagnosing basal cells, our most common type of skin cancer, or least aggressive, but most common, and squamous cell, our second most common type of skin cancer, but approaching the incidence of basal cell probably 1 to 2 times a day.
Wow.
Sometimes even 2 or 3 tumors in the same patient. I am a general dermatologist and a dermatopathologist, so with my experience in clinic and also around the scope, I'm probably making a diagnosis of melanoma 1 or 2 times a week.
That's a lot.
It really is.
And do you think that's unusual in South Carolina because we're in the sun a lot, or is that really across the United States?
I think it's across the United States. I've practiced in a couple other states as well, so it's not unique.
Yeah,
but it's very, very prevalent.
So there's a lot to unpack here today, like what things look like, when you should see a doctor, what you should be curious about. So let's just start with maybe squamous cell cancers. Maybe take me through, how does somebody know if something on their skin could be a squamous? What does that look like?
So when we're asking patients to look at their own lesions on the skin, they should be looking for things that are rapidly growing. Spontaneously bleeding is not a good thing. Obviously, if you cut yourself or nick yourself, it would explain why there's a sore that's bleeding. But the skin shouldn't spontaneously bleed, but also if it's painful. A lesion shouldn't be tender to the touch, and that's a sign that they probably need to see a dermatologist and have a biopsy.
So in medical school, I think I remember reading more that maybe it's red in color or scaly.
Yeah, red and pink. Sometimes it will look like a nodule, maybe even I've seen them come in and patients say this is an inflamed cyst or a rapidly growing painful spider bite, but any new pink nodule that's scaly.
Okay. So then let's shift gears and talk about basal cell, because you said that's also incredibly common.
Very common, our most common, but luckily our least aggressive.
Right. So what would that look like?
That can look not quite as classic. Things can look like a mole. It could be a pigmented lesion, but anything again spontaneously bleeding, pearly, translucent. But of course, we're trying to find them at the bedside at very, very small stages, early stages, so we can treat them.
And will that pearly appearance that you described look the same on an African American as it would on a Caucasian skin?
Probably not. Probably not.
So what should darker pigmented individuals look for on their skin?
A new a new mole that looks different and stands out from other signature lesions. In terms of looking at not only basal cells and squamous cells, but also melanoma, one of the things that I think is helpful is to look at yourself from far away. Does something stand out? So if someone was a darker skin tone and they had very, very darkly pigmented spots across their cheeks, but then they had a new one that was a little bit lighter in a sun-exposed area, I would be worried about that.
Got it. That's very helpful. So let's talk about sunscreen, right? Because sun is the cause of all of these skin cancers. And right now I am cleaning out my closet. I'm going through all of those leftover bottles of sunscreen. And I feel like there's a lot of information out there about which sunscreen should I pick? Should it be spray? Should it be a lotion, a cream? Let's just start at the top. Number one.
Got it.
What do I do with my half-used bottles of sunscreen from last year?
You should have used them by now.
Right.
We're talking about the amount that you should be using with each application, but I'm jumping ahead. They have expiration dates. They don't become unsafe, however. So I'd say slather them on, but probably a good trip to the store.
Okay. All right. So now I'm at the store and I'm looking at each bottle and there, is a list of like 15 ingredients. And recently there's been a lot in, the news about which ingredients matter. So tell me, what are the most important ingredients on that sunscreen bottle?
It's overwhelming, isn't it?
It really is. And they have names you can't pronounce.
Definitely have names you can't pronounce. It's very, very overwhelming. And I think that the most important thing, however, and I do say this to all my patients, what's the best kind of sunscreen? The kind that you use.
Right.
Because if I tell you thick, pasty zinc and you hate it, that's not the best kind for you. So it does take a lot of trial and error to find the type, the product that you like. But the kind that you will use. So if we go from there and we break it down in terms of, well, what else do I need? What do I really want to look for on the bottle? You want it to say broad spectrum, because then you're covering for UVA, the aging rays of the sun, and UVB, the burning rays. You want it to say broad spectrum. You want it to say ultraviolet protective factor 30 or higher. Okay. And you want it to say water resistant. No such thing as waterproof, but that is really how we standardize our labeling now. So it should say broad spectrum, SPF 30 or higher, and water resistant. So then in terms of the different ingredients in a sunscreen, there are the physical blockers, and then there are the chemical blockers, the ones that we can't pronounce.
Okay.
And the physical blockers are the zinc and the titanium. Think of them as metal. They physically block the ultraviolet radiation from reaching the skin.
And that's the thick white.
The thick white stuff.
I always like to call up David Hasselhoff, like in my mind, like the
nose.
Yeah.
Yeah, absolutely.
Okay.
Luckily, we're a little bit more advanced than David was, Mr. Hasselhoff. And we have micronized zinc and spray zinc and all sorts of different formulations that have zinc in them. But also, if you have sensitive skin and you're a person who reacts to ingredients and things, you should steer towards the physical blockers, the zinc and titanium, because, and try to find through trial and error one that you'll use that's zinc and titanium, because it's the chemical blockers, the names we can't pronounce, the avabenzones, the benzophenones, the oxybenzones, those can be really irritating to skin that's sensitive, skin that's acne prone, skin that might be prone to breakouts, rosacea. So they're not wrong, but they can have a little more sensitivity, some tingling, some burning. So if you're sticking with the titanium zinc physical blockers, you usually can't go wrong.
All right. So I think the second thing that you mentioned was you wanted to say 30.
30 or higher.
So let's break down what those numbers mean and, why 30 versus 45, or if it says 70, shouldn't I get the one that says SPF 70? Doesn't that mean that's even better than 30?
So if you're using an SPF of 30 or higher, you're probably blocking, and you're using it appropriately, and we should talk about how much we need to use, but you're probably blocking about 95% of the ultraviolet rays that can reach your skin. So if we're spending our money on 45 or 100, you're really not seeing that much of a difference. So that's why we will say we'll take 30 or higher.
All right, 30 or higher, broad spectrum.
Water resistant.
So is that sport? Because a lot of labels will say sport.
Right.
Is that the same as water resistant?
So they're probably marketing to a population that's going to want to spray or something that goes on a little bit easier and maybe will be resistant to sweat, but it should say water resistant on it, and I think sport is probably part of that label.
Okay, so we've talked about what to buy. Now let's talk about how much sunscreen you need to put on, because this I think will really surprise people.
Well, I will tell you that no one puts on enough. And when the FDA and when sunscreens are tests and when sunscreens are tested and labeled in terms of what SPF they're going to receive on their labeling, they are being tested at, I write it down because it's always something that is just unbelievable, 2 milligrams per centimeter square of skin. Okay. And that's how they test it. So that is a lot. And in average day application, people are probably only applying about half of what they should apply. So
you brought this bottle with you to help us as a demonstration. This is a 3-ounce bottle.
It is a 3-ounce bottle.
Okay.
And if you are applying what you should be applying to cover you for an hour and a half, 80 minutes to 90 minutes reapplication, you should be using a third of this bottle.
Wow.
For one application.
A third of the bottle. So this bottle will last me 3 days.
Yes.
So
if it's just you.
If it's just me. So if it's me and my 2 kids at the beach, this entire bottle should be gone.
Correct.
By the time I go home.
It's an ounce per application.
Wow.
Per application though, and I think that brings up a good point.
Okay.
If you stay at the beach for an hour and a half. But who stays at the beach for an hour and a half? You're lugging everybody out there. You want to be there for a lot longer. And this is where I tell my patients, you got to set your watch. This is the kicker. You could do so well when you leave the house to be ready to go. And if you don't reapply after that water resistant sport hour and a half. Yeah, that's a lot of bottles.
That is a lot of bottles. So you definitely better get something that you'll put on.
That you'll wear.
Right.
Yeah.
So I think what is really important, and maybe people don't know either, is put the sunscreen on before you get dressed and go to the beach. So with my 2 little kids, we know we're going to go to the beach. I slather them all down. Then they put their swimsuit on, and then we get in the car and we go. So typically that way I'm not missing any spots, and it's all absorbed before they have a chance to get in the water.
And that's a good point. It needs to have time to be absorbed if you're putting on the chemical. The physical, the titanium and zinc, you don't normally need that put on 15 to 20 minutes before you get there.
Okay.
Yeah.
That is a good point.
But you should be getting them all lathered up for the beach and thinking about the sun protective quality of the fabric and the clothing that they're wearing as well. Maybe I jumped ahead, but I definitely wanted to talk about that.
Yeah, no, let's go there because you think, oh, I'm going to the beach, I'm going to be out on the boat. Okay, fine, I'll put on all of this sunscreen that they're telling me to put on. But you're walking the dog, you're mowing the grass. Most people don't think about putting on sunscreen. So what are the things that they could be wearing or doing to decrease their sun exposure?
Not all fabrics are created equal. A white t-shirt or linen is going to allow a lot of the ultraviolet rays through the fabric. So nobody wants to wear a thick blazer or jeans in the middle of the summer. This South Carolina heat is real.
Right.
So I would encourage you to look for fabrics in clothing, and luckily there's a lot of sport clothing that now makes ultraviolet protective factors in their clothing. And so if you find a piece of clothing that's UPF 50, what that means, it's a 50th. It has to do with the fraction of ultraviolet rays that are reaching your skin. So UPF 50, a 50th is reaching your skin. So, we welcome sunscreen application, but ultimately hats, sunglasses, as much as you can tolerate, long sleeves. And there are a lot of really nice clothing lines out there that sell ultraviolet factor clothing.
Right.
Protective factor clothing.
And I want to bring up the hat thing because a baseball cap is not what we're talking about, right? We're talking about a wide brim hat that covers the tops of the ears, gives a little bit of coverage over the nose.
The hat hair. I know. And I'll start my physical exam on my patients when I do their full skin checks by touching their ears and feeling for the red scaly spots, the squamous cells. Yeah, it needs to be a broad brimmed hat. I'll take a baseball hat if that's all you got, but I would prefer a wider brim hat.
That makes sense. Okay, so I have my kids. We put on the sunscreen. We have the hats, the sunglasses, the sun shirts. We're getting ready to head out to the beach. what is the best time of the day to avoid being in the sun? Like I've read 10 to 2, 11 to 3.
Yeah.
You know, maybe it varies by which state you live in, but if you were going to say these are the most intense hours, try to avoid them if you can. What are those hours look like?
It's miserable.
Yeah.
You'd be inside all day. 10 to 4.
10 to
10
4.
to 4.
Okay, let's say that one more
Yeah.
time. 10 to 4. That means you're putting on sunscreen, reapplying every hour and a half.
Yep.
Okay.
Yep.
After 4 p.m., can I not put on sunscreen? Am I okay?
You're probably all right.
Okay. All right. So if you don't like sunscreen, get off the beach by 10 a.m. or go after
Seek
4 p.m.
shade.
Yeah.
Yes,
Okay.
definitely.
Oh, that's another great point. People think that if they're underneath an umbrella,
Mm-hmm.
they're protected, but we forget about the reflection from the sand. So even under an umbrella, you should have sunscreen on.
I would definitely recommend if you're by the pool. My poor husband got sunburned sitting by the pool in the reflection off of the pool from the UV radiation.
Okay.
So the sand reflects, the pool reflects the snow. Skiing,
Right.
You'll see in those ski resorts, they've got sunscreen on the wall for a reason. I think we've realized how much that reflects. But even in the shade, in these peak 10 to 4 hours, you need to think about ways that the ultraviolet radiation, not even the burning rays, but the UVA rays could affect you as well. Because UVA, which we can get on a cloudy day through the glass in the shade, is going to have long-term pigmentary changes and age-related changes on the skin that people in general really want to avoid.
Right. Good point. Let's talk about melanoma. So this is the one that I think gets a lot of attention because it's more aggressive. Sometimes I have to be involved as a surgical oncologist, unfortunately.
Right.
So let's just start at the beginning. What is melanoma? What does it look like?
So melanoma is a cancerous growth of melanocytes, which are the pigment-producing cells in the skin. So if you think about what we should be looking for on our skin, we talk about the ABCDEs of melanoma. And we can all remember the alphabet, right?
Right.
So the ABCDEs. And it's surprising because I'll say it to a patient with many, many moles. I'll say, you know the ABCDEs, right? And they'll look at me and they say, I've never heard of that before. So I'm glad we could review what those are, what to watch for.
Right.
So A has to do with the asymmetry of the lesion. If you have a mole, again, these are the pigment-producing cells of the skin, the moles. If you have a mole that you think is asymmetrical, you can't fold it in half, that's something you should be watching. B, border irregularity. Is it notched or scalloped? C is going to be color variation. And I think I mentioned this at the beginning when we were talking about what should I look for in a basal cell if I'm a skin of color. You're looking for color variation within the lesion. Is a little bit of it dark? Is a little bit of it lighter? But also color variation from your other signature lesions. If you make really, really light moles and you have a dark one that stands out, that's concerning. But the reverse is true. Or a lesion that is very pink or a lesion that is really, really dark blue. So that's the color. ABCD, D is diameter. So that's the 6 millimeters and size of a pencil eraser.
Right.
So that's usually when we say that's a big lesion, we need to be concerned. But to me, honestly, the most important is E. ABCDE, is it evolving or changing? So at a certain point in birthdays in your age, you really shouldn't make any more changing moles, developing any new moles. So is it evolving or changing?
Got it. Okay, I have a question to ask you because, you know, people are always saying like, oh, well, I just want to get my first tan of the season. Like once I get my first base layer, then everything's fine. I don't burn anymore and that's safe for me. What do you think about the base tan?
Unfortunately, the reality is that tanned skin is damaged skin. And I'll tell you as a pathologist that you don't want your elastic and collagen looking like that. It is not a pretty picture. I appreciate the desire for the golden glow, but tan skin is unfortunately just damaged skin.
I think one thing that's really like become super popular is the spray tan, right?
Go for it.
So you can go get your base layer. You can look
Love
great
it.
for all the photos.
Love it.
and you don't have to have any skin damage.
Absolutely,
Right.
absolutely.
I think another reason people say they want a base tan is they want to get that vitamin D exposure. And so if they're wearing all of this protective stuff, they're going to become vitamin D deficient. What do you say about that?
It's a huge debate. It's a huge debate in dermatology, and there was a lecture at our academy called the vitamin debacle. So it's not something that everyone agrees on in terms of bone health and kidneys, et cetera. The reality is, unless you are thoroughly and consistently applying your sunscreen every hour and a half, that with incidental exposure, you're getting enough to make vitamin D, to synthesize vitamin D. We know that when the skin makes vitamin D, the required amount of ultraviolet radiation to induce that production is enough to induce DNA damage. And so the Institute of Medicine and the American Academy of Dermatology have a joint statement that says you should be taking vitamin D supplementation, and that's 600 to 800 international units a day, or getting it through fish, fortified cereals, milks, etc.
So what I hear you saying is the sun is not the way to get your vitamin D.
Correct. It's not a safe way to get vitamin D, and it's also not a reliable way to get vitamin D.
Okay. So how often should someone get a skin check? And what does that mean? Who does those? What should they be prepared for? What's going to happen?
You know, I think a good primary care could be a very, very good screener for skin cancers. But at some point when a person has developed a non-melanoma or a melanoma skin cancer, we like to see them for regular skin checks in dermatology. So with our non-melanoma skin cancer patients, our basal cells, our squamous cells, it's very reasonable with a good patient. Annually is reasonable. Some people like 6 months, they're just more comfortable with that. There's other risk factors that can go into the decision to bring people back more frequently, our transplant patients, et cetera. But with melanomas, we definitely want to see our patients for full skin checks, definitely every 4 to 6 months after their initial diagnosis, but then a 6-month plan until they've been cancer-free for 5 years.
So we know in South Carolina, you start from an early age being out in the sun. So do you start getting those sun checks at 20, 30? We know it's what happens in childhood that you start to see when you get older, right?
And that's a really good question, and I get that asked quite frequently by moms I'm taking care of, and they say, well, when should I bring my son in? When should I bring my daughter in? And in general, in a normal situation, and of course it's abnormal situations, but in a normal situation, once you're seeing an adult doctor by yourself, it's probably reasonable if you have a lot of moles and a fair skin and a family history of skin cancer to be seeing a dermatologist.
Right. And anything that doesn't seem right to you.
Correct. Yes, as we said, there's always a special situation.
So let's get into the nitty gritty. A full skin exam, you do have to take all your clothes off.
It's awkward for the patients. It's not awkward for us. We do it 30 times a day, but yes, that's true. And we have skin that can be damaged by the sun from head to toe.
So they're looking in between fingers, in between toes, behind the ears. And then I like to remind people, when you go to get your hair done, ask them to look at your scalp. That's like a free skin check for your head.
Absolutely. We welcome the beauticians, the massage therapists. So we want to know if anybody who's working on you and your body sees something, give us a call. But it should be from scalp to between the toes. And then I also ask my patients, and people look at me funny, why are you asking me this? Are you nagging me? I say, are you up to date with your eye exam? You can have melanoma anywhere you have melanocytes, and that can include backs of the eyes. Are you up to date with your dental exam? You can have it in your mouth. And for my female patients, are you up to date with GYN? And I don't love it when they say, nope, I don't have any parts anymore. Well, you have skin. And we definitely see lesions of concern in genital areas. So I might ask some uncomfortable questions, but that's why.
Right. Yeah. It's all just for your health. Right. Unfortunately, we've all seen melanoma in places where
you wouldn't think.
You wouldn't think.
Yeah.
So we've talked about so much today, and I hope it's been really informative to those listening. I've certainly learned a couple things myself. So we talked about the type of sunscreen to get. Number one, it's something that you're going to apply. It says broad spectrum, has a coverage of SPF of 30 or higher, and you have to apply it every 90 minutes.
Yes, water resistant 90 minutes.
Water resistant 90 minutes, 1 ounce, so a third of this bottle. Look for the ABCDEs
Yes.
on your skin.
Yes.
Anything that's new or changing, just bring it to your dermatologist or family doctor right away. Anything else that you want to share with our audience today that we might have missed?
Screen your partners too. Look at their back. Look at your, you mentioned your kiddos at the beach. Look at your partners, your loved ones, because they might not be as diligent at looking at their own back. So
we've come a long way in treating skin cancer. Melanoma used to be incredibly scary. It was a death sentence. We didn't have great treatments. And I think the most vital thing is early detection.
Absolutely. I know that can keep them out of your office, which isn't necessary, which is a good thing. And I know that you really do feel that way.
It's much better for you to see a dermatologist than a surgical oncologist.
Yes.
Dr. Scribner, thank you so much for being here today. And thank you for tuning in. Hollings Crosstalk is where we connect with the community to share the news that is changing what's possible. If this is your first time watching, make sure you go to our multimedia page to watch past episodes and check out the Hollings news page for our latest updates.